Flavia. Thank you so much, and it's a pleasure to be here. Thank you for having this opportunity. And yes, I will try to bring you a couple of examples. So I think this is a nice bridge to what we had earlier in this session, because I'm going to focus a little bit more on what we are observing in Italy. And as was said before, my interest is on the One Health element of this. So I will be focusing on the human surveillance data, but I have to acknowledge that this work is really a combination work that brings together a lot of actors. What you see here are the people just at the national level, and this you have to consider also builds on the 21 region and autonomous provinces that have also the same distribution of sectors. So we're talking human health, animal health, entomology, blood and transplant safety. So all of this is combining in the data that I'll be presenting to you, and some of it I will be quoting work that has been done by the Bruno Kessler Foundation. So I'm just going to try to give you a little bit of examples of what's happening right now, what we're observing, and how we're already seeing, not only from the models, but also from the data, how things are changing. So first of all, I wanted to step onto West Nile. As was presented earlier, it's a rather complex diseases, and humans are a dead-end host, so we're not really that representative when we look at the distribution of cases, but we don't contribute to the transmission of this disease. As for Italy, emergence has started in the late 90s from the animal world, and then we started having human outbreaks, as you see here, from the early 2000s. Since then, we've had cases every year. And as was presented earlier as well, you might see that most of the cases we had observed were in the northern part of the country, mostly in the semi-urban and rural environment. So sort of the interface between the true cities and the villages and the rural areas. Those were where most human cases were happening. But then we had, and that was said before, in 2018, we were among the countries in Europe who had a very high circulation. We started asking ourselves why this had happened. And then we had another very, very intense year in 2022, which interestingly did not affect other countries in Europe. It was much more localized. It affected mainly the Veneto region, which is in the northeast of Italy. So we started asking ourselves, you know, what is happening and why are we seeing this change? Are we just getting better at finding West Nile, or is it really changing in its distribution? So what we saw, and this is thanks really to the data of the Istituto Zooprofilattico of Teramo, who coordinates the surveillance of the mosquitoes and of bird surveillance. So we have grids, we look for West Nile, so we have positivity of pools for West Nile across the country, and this is coordinated by them. What we're seeing, and I'm just going to touch briefly, is that the same things didn't happen in 2018 and 2022. So in 2018, we had a widespread increase of circulation in mosquitoes. Sort of, it was everywhere. We also found it beyond our main vector, which is Colic-Pipiens, and also in birds. While in 2022, it seemed like the bird population were more affected, again, more localized, as I mentioned, but the impact on the increase of mosquito balls was not as evident. So things that looked very similar, if you look at it from a human perspective, might look very different when you look into the enzoonotic cycle. And this is why it's so important to have this One Health approach for West Nile. We really can't understand much if we don't look at things in perspective. But if we do look at the human data, and these are just the more severe cases, and we like to use those because they're more comparable from one year to another, is that we're seeing a change. We're seeing an increase. So it's not only bad years. It's not only 2018 or 2022. I mean, the last years have all been pretty much bad years. We're starting to see those numbers come over and over again. So if you can see, you know, we were used to seeing cases or severe cases around the 30s, 50 cases. Now we're used to seeing over 200 in every year, and this is something that we think is changing. It's changing in number of cases. It's also changing in terms of geographical distribution. We're seeing an increased detection in the center, in the south of the country. So very much in line with what was presented earlier as a projection. We're actually seeing it already. Of course, again, we might be getting better at finding it. That's an element, always there and always present, but this is what we're observing. So We're seeing it expand in the number of cases and in geographical distribution. So these are just to show you what it looks like at the end of each season in the last 3 years. So moving on to dengue. Now, dengue is much more new for us in terms of a locally acquired infection. We weren't really aware of dengue as something we could have locally until very recently. In medical school, they teach you it's a tropical disease you contract when you travel abroad. So again, we're in a moment in which we still have to change the way we think of this virus, also in terms of suspecting dengue when there's no travel, for example, in late summer. And that's something that we need to be working on. So again, much more simple transmission. In terms of vectors, as you can see, and as you know, we have quite the abundance of a competent vector, which is Aedes albopictus. So far, and again, I can't touch wood here, but we haven't seen Aedes aegypti for a long, long time, and we hope not to see it again. But then again, it's one of the things we're looking out for. Our entomologists are warning us about. So I'm just going to start with the conclusions around dengue because I thought it was easier to do it this way. So I'm going to show you how the modeling is telling us that ecological conditions are favorable in part of our country, especially towards the end of the summer and the autumn, and especially around the coastlines, which means quite a lot of the country might be susceptible for local transmission. And there's a stochastic element to it, so it really depends on a person coming in and finding by chance the right mosquito, the right temperature, and the right conditions over time. So we can't really say that if you've had an outbreak in an area, that area is more prone than another to get an outbreak again, which of course has a huge impact on the planning process around what you do about it. Then we've seen, of course, a lot of cases have happened last year and this year. It's very new, not completely unexpected, though quite unusual, at least for us. And it's in line with the growth of the dengue distribution and the case counts we've observed globally, increase in travel after the end of the pandemic. And these two things combined have led also to an increase in our observed importation of dengue cases in Italy. So this has been quite relevant, and our local transmission has been highly localized, mostly within municipalities, sometimes within neighborhoods. So that's what I had until now. And just to say that as of the 19th of November, we've had several clusters. I'm going to show you all of them under control. Most of them actually are closed, as we haven't had any cases in the last 45 days, which is what we're using as a benchmark. So just to tell you that, of course, local vector-borne dengue transmission is nothing new in Europe. It has happened before. We've had been reports since 2010, basically. But we're seeing a spike. We're seeing more cases recently. And as for Italy, we hadn't had local cases until 2020. So for us, it's very, very new. And this is what our epicurve looked like as of last year. So this was our first local cluster. It was in the Veneto region. We had 11 cases, all linked to a travel-related case. And as you can see here, was a dengue one, and it was related to a case traveling from Southeast Asia. It was in a very rural area, and it's the connections were quite significant. So it really was around houses in a very non-urban context, so widespread and with wide areas of garden and of nature, basically. But then things happened last year, so it changed quite a lot. As you can see, numbers are much higher. And what happened was that we had two regions that were affected. These are regions where the major cities are, the highest population density is. So we had one cluster in Lombardy, again with a dengue one, but clustering with South American strain that was epicentered in a small town, and with a transmission that occurred over time, so from July up to October. And this was quite surprising for us. We weren't expecting it to be so sustained over time. We kind of expected things to happen a bit like in 2020, cases clustering around an important case and then ending. And likewise in Lazio, so where we are now, where the capital is, we had several clusters, different dengue types, as you can see, with cases in Rome and in a neighboring town, and then in a town in the south of Rome. Dengue 1 was not related to the Lombardy case, so it was an independent introduction. And again, the local transmission lasted for quite a long time, a bit longer, but that also is in line with the climate. So we know that in the center and the south of Italy, the cool weather of the autumn comes a bit later than in the south, and we connected those dots empirically. So you can see where the locally acquired cases were in 2023 and where they were, the travel-related cases were. And of course, they are higher in the areas where the local transmission was, also because that's where the major airports are, higher population density, and also higher likelihood of travel internationally. So where are we now? So far we've had, you see, almost 500 confirmed dengue infections due to travel, related to travel, international travel, but over 200 local cases, so higher compared to 2023. The median age, as you can see, is 45 years. We haven't had any severe cases. We haven't documented any deaths. But again, we haven't seen cases, a lot of cases in the extremes of age, which are related to higher morbidity and mortality. Were we expecting this? Well, we were expecting it to be a risk. If we look at the number of imported infections documented in the first 4 months of the year in the past years, you can see that this year was a year in which we had a much higher number of imported cases. So we knew that the number of imported infections was increasing, and therefore the chance of one of them being able to trigger local transmission was higher, of course, overall, the overall chance. And this is what we have now. So we have these cases imported, as you can see, pretty much across the country. And where they come from, well, that reflects a lot where dengue is circulating, nothing new there. So people are traveling where dengue is present, and cases are being detected once they return home. In terms of the local transmission, the situation is a bit different. We've had clusters in quite a large part of the country if we look at it by region, but actually what I mentioned before, the transmission is happening at a municipality level. So if we look on the right here, you can see that the different colors represent different municipalities, and you will see there's a lot of blue. Now that is one big cluster that we had in the Marche region, which now has 143 cases of confirmed infection documented. And it's a dengue 2 virus cluster, principally around a single municipality. So most of the cases were in a range of 1 kilometer. But then in the later expansion of the outbreak, they tended to be a little bit more widespread. What we observed, and this is a paper that just came out last week on neurosurveillance, if you're interested, is that actually upon detection and the activation of measures, transmissibility goes down very fast. So we go below the epidemic threshold in one single I don't get the word now. So in the time that it takes between infection in a mosquito in a human and then a human again. So it's a generation time. So that's one thing that we noted. So the transmissibility goes down and goes down very fast. So it's probably a bundle effect. We have behavior change, we have vector control, communication, and so forth, and attention of the clinicians, a number of actions that together are being effective. And this is something we've seen consistently actually in other dengue outbreaks, but also for chikungunya. So once detected, transmission goes down very fast. So we can't really disentangle what is working and what is not, what is working better, but we know that overall the good news is that it is working. The thing is, however, that we found very high reproduction numbers, very close to what's seen also in endemic countries, which is a bit worrying. So in certain conditions, transmission can be very effective. And the second thing also is that we've seen a trickle down of cases. So transmission does not end completely. We do see a number of cases going on during the season, and that's why, for example, we're still not closing all of our clusters, because we want to wait these 45 days. Dengue is much slower than COVID when it comes to generation time. So of course you have to consider that in the extrinsic and intrinsic incubation period. So this is just to say that the situation is ongoing and very much changing, and we're learning as we move along. So each season is teaching us what's what's happening in relation to this disease. So this is just to give you an overview a little bit of the type of measures that are in place. So as opposed to West Nile, we don't have a grid surveillance for vectors, but we do xenomonitoring upon suspicion or detection of a local case. So that's why we are able to match mosquito viruses with viruses in the mosquitoes with viruses in the humans. And also we have blood and transplant safety measures that are enacted. So going towards a wrap up, so the surveillance system in Italy is integrated, as I was mentioning. It's been evolving over time from 2010, including more diseases, including more actors, and is now part of a 5-year plan, which is going to be renewed next year. So this is an ongoing process in which basically we learn on the basis of also how the epidemiology is changing and the data is coming from all the different actors. And for West Nile, at least, we have evidence that this is providing an added value in terms of early warning, because we're able to detect the circulation of West Nile virus before we find it in humans, which for us is a huge added value. We can act on SOHO measures on the substance of human origin before we have the first case. And that's something that is quite unique to Italy. And this is the kind of image that I usually comment on this. So in gray, you see the cases of cases of West Nile, pools of West Nile positives in birds, horses, and mosquitoes, and the colored ones are the human cases. And you can see how, for example, in 2022, as I mentioned, was quite a rough year. I'm kind of not very good at this, of pointing this. But anyway, so you can see maybe at the beginning is that we had grays in June, and then we started having the colored ones. The idea is that we find them first in the mosquitoes. And interestingly, also the first human case that was found was symptomatic. But then you have quite a lot of asymptomatic blood donors being detected later down the road. That means that they detected once the screening of blood donors is in place. So measures were there before the human cases were, or they were enacted at the same time. So that's the kind of added value of the One Health approach to this type of disease. Of course, it's changing. So we've seen first local transmission events in countries that didn't have them, but also in parts of countries that never had those events for West Nile. And we are seeing a growing size of clusters with increased frequency of outbreaks. And, there's been a discussion of the south to north, but as you can see, also a south to south expansion of interested areas, so areas with transmission. When it comes to drivers, of course, we've heard temperature is a critical element. It impacts a lot on the breeding, on the extrinsic incubation for West Nile. But the interesting thing for us is that climate anomalies were quite different in 2018 compared to 2022. So aside from temperature, how those different factors play and what their impact is still something that we're looking into, trying to understand, are there, aside from temperatures, other elements we could use, maybe as even earlier triggers to let us know that the conditions are there for a high transmission years for West Nile. In terms of dengue, modeling is telling us that climate suitability is present in several parts of Italy, and it's particularly evident towards from August to November, December. So towards the end of the summer and into the autumn. This study has shown a possibility of transmission above epidemic thresholds as you can see from the picture here, in the areas that had outbreaks in the past, but also in areas that never had them. And that's why we really have to think in terms of planning as to considering different parts of the country as potentially susceptible, and therefore stepping up our clinical suspicion, first of all, that it might be dengue when we're looking at people with very specific symptoms. So just to close, and thanking you again for this opportunity, in the context of our training climate, what I wanted to say is that we're already seeing changes in the epidemiology of some of those diseases. It's not something we're only seeing in the models, but we're already seeing it in the surveillance. And therefore, we need to adapt our systems, our plans, to make sure that we're better suited to deal with these emerging diseases. Thank you.